Welcome to Adapt NCLEX. If you're in nursing school or preparing for the NCLEX, newborn, especially from birth to 12th month, you got to master. When it comes to growth and development, these are the areas they asked. We're going to talk about motor functions, what happened at each month. I'm giving you simple mnemonic that you don't have to memorize. You want to stick around and learn this mnemonic to be able to remember any question regarding motor function. Let's go. First, let's see this question. We'll come back and answer it. A nurse is assessing an 8-month-old which action is appropriate to test fine motor skills. Offer a soft rattle to grasp. Ask the child to draw with a crayon. Observe for thumb finger grasp with the small foot. Test the child's ability to follow verbal command. The buzzword is what? Fine motor skills. Which of these action is testing fine motor skills? Look at the age group, 8-month-old, and fine motor skills, and look at which of these action will help with fine motor skills. That's all. But let's get to the topic. Mnemonic to remember those motor function is what? Newborn are going to lift their head. At 4 months, they're going to roll. At 6 months, they're going to sit. 8 months, they're going to crawl. 10 months, they're going to cruise. 12 months, they're going to walk. There's so many changes that occur, but these are milestones. Milestones are things you have to clear to move the next one. So NCLEX will ask you about the key milestone. Newborn, 4 months, 6 months, 8 months, 10 months, and 12 months. Therefore, what are the mnemonic I want you to pay attention to? From birth to 1 month, I'm going to lift. And if I lift, what I'm going to do, raise my head slightly. When I'm prone, my face is down, right? Then what would I do? My reflexes is still there, so I'm not strong. We'll talk about reflexes in another video. But what is the thing? My hands are clenched together and have random movement. There's no coordination. Therefore, what is the key? At birth to 1 month, I'm going to what? Lift. Lift the head slightly from the tummy position. The next group are what? 2 to 3 months. Before they get to the 4 month, they have to control their head. If you lift yourself up and you can't control your head will be bobbling, right? And so improve head control while upright. As they lift themselves, they learn how to stabilize their head. They begin to track objects. You can't track objects if you can't stable your head. Think about it. And then they start opening their arms to support themselves. All these are reaction. I lift my head up and I open my hand to support myself. Next time I will be rolling. Therefore, normal 2 to 3 months is what? I control the bubbling head. That's the key, control of the bubbling head. Therefore, by 4 months, I've already had the control of my bubbling head. I'm already getting strong with my hand. Therefore, before I realize, I'm going to flip. Rolling is at 4 months. And what would they do? Are they rolling from their tummy to the back, not the back to the tummy? They're rolling from their tummy to the back. And then they push it at the elbow. This is going to help them roll from the other side. And they bring their hands in the middle now. They want to roll from both sides to another. Therefore, what is the mnemonic for 4 months? Is what? Like a four-wheeler. The four-wheeler is the 4-month-old who rode, right? They're ready to roll like a four-wheeler. And then at 6 months, I can start to sit myself up, right? I can sit myself up now with some support, but not strong, but at least they can sit up because they can control their head. They can roll from left to right and they can push on themselves, right? And then they roll from both ways, left and right, front and back and forth, front and back and forth. And they can bear weight on their leg. Remember, I can bear weight in my leg. I'm trying to get up. Therefore, I can transfer objects from hand to hand because I can roll from back to back and I can sit down, right? These are the clue. Therefore, at 6 months, the key thing is I'm going to sit with a little bit of support, but not completely sitting without a support. A little bit, but at least I'm making an effort. Then at 8 months, I'm starting to crawl. I will crawl. 8-month crawl. They sit without support now. You don't need the support, and they can start moving, right? And they begin to crawl and scoot around, looking around. They start developing what we call pencil grab, trying to grab things with their finger and their thumb. This is what we call crude pencil grab. It's not the fine one. It's the beginning of a pencil grab. It's a crude one. So when they ask you a question about pencil grab, look at what they're asking. Are they asking you for a fine pencil or a crude one? Who to sit themselves up, because they can sit down, they can support themselves, they can roll from back to back, therefore they can lift themselves up and sit down. So what I do in my 8 months, crawling, crawling, crawling. Figure 8, move like a crawling. Finger 8, move like a crawling loop from left to right, right? That's the mnemonic. And therefore, if I'm already crawling at 10 months, what is going to happen? I'm cruising, full to stand position, right? And I cruise along the furniture, trying to walk around them. And then my pencil, which was crude before 8 months, now is going to be finer grasper, right? And I'm going to cruise at 10 months like a speed, cruising like a bike. That is the key about these kids. At 10 months, we are cruising. And finally, at 12 months, it's time to walk. If I'm cruising, walking is the key. Everything is related to walking, right? Walk with or without help, stand alone, may start to what? Stack block or drinking from a cup. But the motor function that I want you to pay attention to is walking at 1 year and start taking steps. Therefore, what is the key? Lift, roll, sit, crawl, cruise, and walk. What is the answer thread for the question that we had? This is the question we had. And this is assessing an 8-month-old. Which action is appropriate to test fine motor skills? You know, the fine motor skills start between 8 to 10 months, right? Then to the 12th month. In the beginning, they have crude pencil grab. Then they will start to have what? Fine grasp, right? Therefore, fine pencil grab. Therefore, which answer would you pick? 8-month-old, testing fine motor skills, holding on to what? A rattle is a gross motor function, right? It's just basically for babies. Ask them to draw a crayon. It requires some fine and coordination. The kid does not have, 8-month does not have that kind of coordination to draw with the crayon. They can put their thumb and finger together to grab small object. That is a fine grasper, right? Fine motor function, right? Testing the child ability to follow verbal command is not the right answer. So number 3 is the right answer. If you watch the video and look at it carefully, it's an application of this mnemonic. Thank you for watching and good luck in your exams.